The concerns about moving to an EHR is always physician adoption of the EHR. It's generational. You have the baby boomer like I am versus the generational, the millennial, or the gypsy now who lives with a computer. So it's the adoption of the provider able to handle an electronic medical record. And now the issues or the things that you must do for governmental regulation, as well as for payer regulation, it puts a huge burden on that physician. And I was recently at an AMGA meeting in which my CMO led a discussion group of 150 CEOs, CMOs, as well as chairmans. And he asked the question, how many people in the audience feel their physicians are happy with their EHR and are not happy with the EHR? And every hand went up. So it doesn't matter what EHR you have. The constraints that the doctor feels that he has to be an IT support person rather than hands-on with the patient is of great concern. The reason why the self-pay has dramatically improved, I think it's patient preference. It's an easier way to pay a bill. I think there are people who do not trust being online. You know of all the breaches that have occurred with Anthem and Target. I think there is some concern about confidentiality in the EHR, but I do feel it's going to be over 90%. Training is very important when you move to an EHR. To be honest, I'm not sure I remember the training back in '97, but when we moved to Athena this past August, it really is all about training. We've had doctors come out of the offices. We've had multiple training sessions. We had them do online training beforehand. So for the physician to feel comfortable to move to an EHR, training is of utmost importance. The amount of time a physician needs to be comfortable on an EHR is really dependent on their own ability to understand IT technology. But on the average, it could be 8 to 12 hours of pre-training and demoing and dummy patients before you feel comfortable. The amount of time is very significant for that training. And when you are in a multi-specialty group that has 550 providers, it does affect the bottom line to pull the physician out for that amount of time. But you look at Saturdays, Sundays, evenings, and the doctors understand and they know that to move into the fee-for-value type of atmosphere where we're moving towards rather than fee-for-service, then you have to have a fully integrated EHR.